Okay, so we are right at 12 and we've got quite a few of you on. So I'm gonna go ahead and get started. I've timed this a couple times. Sometimes I'm at 25 and sometimes I'm at 28. So I want to make sure we have time for any questions or discussion at the end. So we can get going. Today, I'm Angie or Angela Matthewson, one of the dietitian nutritionists at Florida Cancer Specialists. We will have the little chat box open throughout, or the chat box probably works better. If you think of questions and feel like you need to throw it in there, I will save them till the end, but it doesn't bother me if you put it in there before I finish. All right, so today what we're doing is considering some alternative or different ways to think about weight and health and how those two interact or interact. All right, so first I want to look at this chart. It's really just an example chart to fill in for hundreds probably of charts we've seen similar to this. We're all familiar with the fact that worldwide, this is an American United States chart starting in 1960 going to 2018. From the National Center for Health Statistics. So it's a good solid one. But we're all familiar with this trend, right? We've heard about epidemic or war on obesity. We are all very, very familiar with the fact that weights in the US are increasing over the last several decades. What we might think about less often is the fact that at least, so the break here kind of starts in 1980 where we see a real sharper line or slope. In that same time, we've also seen a tremendous increase in attempts to lose weight. We've also seen an increase in weight bias in that same time frame. I will talk not in as much detail as I could, but I will get to weight stigma or weight bias a little bit later on. But the first thing you might think if you see that chart of the increasing weights along with increasing weight attempts, if we've got more of something at the same time that we have more efforts to stop the thing, we might wonder, well, what on earth is going on? Now, traditionally, of course, the weight loss attempts are how we respond to the rising weight. So is there an alternative to that? There is, according to the proponents of weight neutral or weight inclusive approaches. You may have heard both of those terms or you may not have. They are used pretty much interchangeably. And there are two I'm going to highlight two main organized methods that fall under this umbrella, and we'll talk about them each in not as much detail as I could, but what I can cover in 25 to 28 minutes. So we'll talk about them and their structure and their principles. Body positivity is a lot less organized, but I do want to touch on it. It's the hashtag, right? If you're on any kind of social media, you have probably seen a hashtag BOPO or hashtag body positivity. And it's a concept that's really included in both the health at every size and intuitive eating models. You might notice there's a little R next to health at every size. I did have to put it there because it is trademarked, and I want to tell you briefly why. So health at every size, the trademark is actually held by a group called the Association for Size Diversity and Health. They trademarked it in 2011 because they were starting to worry that it would get co-opted by the diet industry, kind of taken over or steamrolled, however you want to put it. But it's before their trademark, there's actually a book that was previously called Health at Every Size, and that was written by a well-known academic researcher named Lindo Bacon. So that does get a little confusing, but the trademark is currently held by ASDAH. And ASDAH is also the group that has the 5 principles, which they are due to renew, but these are their current principles. Weight inclusivity, right there at the top, the first principle of HAES, and HAES is just an acronym for health at every size, which is also trademarked. So weight inclusivity asks us to accept and respect the inherent diversity of body shapes and sizes and reject the idealizing or pathologizing of specific weights. So that's fairly straightforward. This next one I'll unpack a little bit for you. Health enhancement. Support health policies that improve and equalize access to information services and personal practices that improve human well-being, including attention to individual physical, economic, social, spiritual, emotional, and other needs. That's a lot of words, but I actually really like this one because it's doing two things for me. It's recognizing that I am an individual and I do take actions that have an impact on my weight, but I also live in a world that's made up of systems, and the systems are going to impact my health as well. And it's also recognizing that my well-being is not just about my physical body. And so it's the whole self contained there in that health enhancement. Third is eating for well-being, and that asks us to promote flexible, individualized eating based on hunger, satiety, and nutritional needs and pleasure, rather than externally regulated eating plans focused on weight control. So I'll get to this in more detail in a minute, but Hayes is not saying that our food choices don't matter. It's saying we should pick foods that nourish our bodies and make our bodies feel good for the purpose of being healthy and happy, not for the purpose of changing our body size. Respectful care is the fourth. This is longer. I'm not going to read the whole thing, but it's just asking us all, healthcare providers, and those of you on the call who are not employees or healthcare providers, but just patients or just human beings, and all of us are, it's asking us to look at our biases and acknowledge that we may may have some weight stigma of our own. And again, we'll talk about weight stigma more in a moment. Life enhancing movement is the Hayes fifth principle. And this asks us to support physical activity for people of all sizes, abilities, and interests, that they be able to engage in enjoyable movement to any degree that they choose, so that nobody feel left out or unable to participate in an activity. But it's also suggesting that we engage in physical activity for the purpose of the health benefit and enjoyment. So now for those misconceptions, there's lots of them. I really brought it down to the two that I see most often. First of all, Hayes does not suggest that each and every one of us is doing our best health behaviors, or that we are as healthy as we can be. It's not saying that. It's just shifting the focus to our health behaviors versus our body size. It also does not lead people to eat with abandon. I mentioned that Lindo Bacon was the researcher who's written the book called Health at Every Size, and they and one of their main co-authors, Lucy Aphramore, they did a big article on this on weight neutral approaches some years ago, and they tell us it has been disproven over and over by the evidence. There's never been a trial on Hayes approaches that has shown actual weight gain or decreased healthy eating. Healthy eating habits have either increased or stayed the same when we have a health at every size based intervention. So again, the food choices are not being thrown out the window or just said that they don't matter. It's why do they matter? And they were having them matter because of what they do for the inside of our body versus the size of our body. So intuitive eat, oh, sorry, I have one more slide here. That is what does Hayes look like in practice? We are focusing again, shifting our focus to the behaviors without centering weight. So whether it's me who goes in and gets a diagnosis of hypertension, or somebody in a smaller body or a bigger body, nobody mentions our weight. We are told what kind of diets promote normal blood pressure, and that exercise promotes normal blood pressure. Again, we see good results with health at every size based interventions, including improvement in things like blood pressure and lipids, as well as psychosocial things that matter, I think, to most of us, our mood and self-esteem and our body image. We see good adherence to health behavior recommendations and lower recidivism, which is a fancy public health way of saying that people don't drop out. Now I'll move on to intuitive eating, and intuitive eating is closely aligned with health, with Hayes. They stipulate that in their site. They do predate the language to some extent. These two dietitians are the ones who author the book Intuitive Eating, and they created the concepts. So Evelyn Tribole and Elise Resch. This first edition was 1995, so it's been around for a while also. Both concepts really share a lot of the core components. Intuitive eating has 10 principles that they're going to suggest for us. The first that these intuitive eating pros, as they call themselves, they promote for us to reject the diet mentality. They call it a false idea that there's an easy or quick or permanent method out there to lose weight. So they want us to let go of that idea. They want us also to honor our hunger. So that falls in line with Hayes right there, right? They want us to honor our body by fueling, honor our body and our hunger by keeping ourselves fueled. Make peace with food. I'm a big honesty is the best policy. I have trouble personally with this one. I think it is super important, but it's not always easy to do. You know, there's a strong tendency to moralize our food choices. This making peace with food is really asking us to give ourselves unconditional permission to eat and challenge the food police. A lot of times dietitians are accused of being the food police. I try not to be that person, but the food police are also the ones who connect that moralization to food and make it, oh, I was bad, I ate X, Y, or Z. I hear that a couple of times a week. And even if it's not said out loud, I can kind of hear it sometimes, and I can see it in myself. And those are the two that are hard for me, even though I've been working on this for a little while. This one I love, discover the satisfaction factor. This one tells us that it's okay that food is pleasurable, that it's supposed to be, it can be, and it's supposed to be. It also asks us to eat mindfully. Mindful eating sometimes gets confused with intuitive eating. It is talked about separately quite often, but it's part of intuitive eating as well. So mindful eating is the part of this framework that's really just, when you're eating, that is what you're doing. Stop and eat and enjoy your food. So you are going to be satisfied with the foods you're eating. You're going to be choosing foods that taste good and do good things for your body. Also, in the vein of mindful eating, feel your fullness. So if you are eating mindfully, you will notice when you are full. Cope with your emotions with kindness. This one is interesting to me. It talks a lot about emotional eating, which is something that I hear from friends and patients and family often enough. I'm an emotional eater, something on that vein. And this one is saying that that will happen. And again, you're not a bad person, but to stop and think, if you're about to eat emotionally, that that's not about your body, and maybe think if there's a more useful way for you to deal with those emotions, a kinder way. Number 8, also I really do love. It's they call it respect your body, and they say that you deserve dignity regardless of your size and shape, and you do. And you deserve it from yourself as well as every single person that you encounter. Here we have a really similar one to what we saw with Hayes, which is movement, feel the difference. So they're separating movement, enjoyable movement, from militant exercise. So when you're exercising, you can stop and think about, how does it feel? Is it enjoyable? Is it enjoyable in the moment? And is it enjoyable the way you feel afterward? Not to see that like 500 calories burned on the readout on your workout machine or whatever, but like, how does your body feel when you're done with that workout? It doesn't mean that the workout has to be easy, right? I mean, I do some yoga workouts where they're really hard and I might want to stop, but it's not painful. And then afterward, I do feel that glow. So focusing on that versus, ooh, this is making my body do my shape do this, or the number on the scale do that. And it is, again, this is honor your health through gentle nutrition. So this is their way of saying that our food choices matter, but for the purpose of the benefit to the inside of our body versus what it's going to do to the shape of our body or the size of our body. Okay, so now I'm getting to that body positivity part. I think most of us have heard that term. You might not have heard a related term, body neutrality. It's a little bit newer. They both are asking us to accept all bodies, regardless of size, shape, skin tone, gender, or physical ability. And they're also asking us to focus on our own and other people's overall health versus their physical appearance. The big difference is that body positivity is telling us to love our body no matter its shape or size, and to not and to accept the beauty of every other body out there. Body neutrality is a little different, or maybe others will think it's a lot different, but body neutrality is telling us that our body is just the vessel for who we are as a person. And so we don't have to like what our body looks like, but they're encouraging us to still love ourselves, and kind of our body is not part of the equation of whether we're worthy of love, that we're all worthy of our own love and acceptance from others. So I do want to pause and know and recognize, some of this seems maybe easily acceptable to a lot of us, but maybe not. We have, all of us most likely, been interested in health for a long time. Again, whether we work in healthcare or we're a patient who's taking extra time to learn more about health. And health has traditionally been strongly associated with weight. So I recognize that, and it's okay if it's hard to let go of that idea. I want to just talk about a couple of things that I have learned in the past few years that may help with that. So here is another chart that probably everyone's seen. This one is just a chart I found on Google Images for body mass index, BMI. But we're very familiar with the structure of it, right? It's our height versus our weight. The green is where we're taught we should be. And then as we go higher up, those are the categories of overweight and obesity. So the conventional wisdom is green is where you want to be, right? So 18.5 to 24.9 has been titled healthy or normal, and it's what we it's ingrained in us that that's where we're supposed to be, or has been in me, and that the mortality would increase as you go up. There's an idea that the higher the BMI is the cause of poor health. In fact, there was a meta-analysis by Flagel et al. Back in 2013 that showed the mortality risk did not start to increase until the BMI of 35. And 35 is halfway through this little orange area up here. So it's that's what would be classified as obese 2. 30 to 35 is obese 1, and then 35 to 40 is 2. And so the mortality risk didn't go up until 35, and that was in the same league as the underweight, which we don't hear a lot about, worrying that people are too low weight, but that was an equal mortality risk. The lowest one was actually here in the yellow, the caution zone, that we label overweight. So that was the lowest mortality risk. And then in between, and really comparable to each other, maybe not a dead tie, but really comparable, are this green zone, 18.5 to 24.9, and the 30 to 35 BMI. So really different from what we tend to assume or hear, conventionally believe. Yes, there are some higher associations between higher BMIs and risk of certain diseases. However, the studies that show us that have not tended to control for fitness and activity level or weight cycling or socioeconomic status. When we control for cardiorespiratory fitness and physical activities, the BMI association with disease and mortality either goes away or is very much lessened. Same for socioeconomic status. We've actually known since the 50s that diabetes is more strongly associated with poverty than it is with body mass index. And we've known similar things about cardiovascular disease. I want to stop and talk about the weight cycling a little more than those other few. What does weight cycling mean? It's just the yo-yo dieting that we hear about, and we all kind of know that it's not the best thing for many reasons. We certainly know that some people lose weight and keep it off, but we do recognize that that is not the norm, right? Diet and exercise don't always lead to weight loss. I talk to people every day who I fully believe are doing the things they tell me that they are doing, and the weight is not following the trajectory that we think it should. It is more common to see this in people who are classified as obese because they are told either explicitly or implicitly that they need to lose weight. So they try and they either do and don't keep it off, or they don't lose. Unfortunately, when the focus is on weight and this happens, the take-home message is that the actions don't matter, when in fact actions matter very much to our health regardless of the weight. Weight cycling is damaging. I again could talk for 30 minutes about why that is so, but when we account for weight cycling, it has been able to explain the increased morbidity seen in the National Health and Nutrition Examination Survey and Haynes and the Framingham Heart Study. And why is that? Why can't we just diet and exercise and keep the weight off? It's more complicated than that. I think we know this. I think that this is probably doesn't seem radical, yet we have this false understanding, right? That it's just your diet and your exercise determines your body weight. But there are all these other factors that are, if not totally out of our control, not easily within our control, and they all impact each other. And I have vastly simplified for my own little chart here that drove me almost bonkers making all these lines because I really wanted to have each and every line in there. There are so many more things that impact our weight than just the diet and physical activity. Because we have this false understanding, though, it's very easy if we see somebody who is outside of those weight parameters that we've set to think that they're not doing something they should be doing or are doing something they shouldn't. And that's where weight bias comes from. So, and that is why we see increasing weight bias, because people tend to think that it's a justifiable bias. Basically, if you have ever looked at someone and thought that you knew anything about them based on their body size, I know that I have been guilty of this, and it is it's good to look at that and stop and realize that you don't actually know anything about the person based on their body size. But this is prevalent. It's everywhere. It's in education, the workplace, healthcare. It's among our family and friends, and it's internalized. So we may feel this way about ourselves. And there is bias in healthcare, and I've been working to try to eliminate my own, because people know when you're expressing bias toward them, even if you don't say it out loud. And this can create a threat response that causes people to not follow up with you. In some settings, it will prevent people from getting screens they may need. So it is harmful. And I can't go into it at great length because I'm trying to be good on time, but it is something worth considering if you're a health provider on this call. So If this all feels still a little radical, a little out there, I want to bring it back to just a few core concepts that I feel like we should all be able to get behind. So weight inclusivity at its core acknowledges that body size is not simply the result of personal action. It also asks that we be seeking to improve healthcare access for everyone by challenging our bias. So the challenge, those are all pretty entwined. And then we're focusing on the whole person. So a person's health is not their weight, a person's health is not the person, et cetera, et cetera. And I would ask that we shift our focus from the weight to the overall health and well-being. So I just took my little chart here and relabeled the center focus from weight to overall health and well-being. I want to point out that these four at the top that I kind of simplified everything to, they are part of what is known in public health as social determinants of health. That I could probably talk about for 2 hours. It's things like housing, your neighborhood, whether you have access to good job opportunities, education, whether you're exposed to pollution. You can't control those things about yourself. I can't control them for myself or you or patients, but there's two things here. It's important to recognize that these are social determinants of health are highly correlated with health outcomes. We can't necessarily control them. They also impact weight. And it can start to feel a little hopeless because I've said that the actions are less important, but in determining the total outcome, but the actions are important. The actions do matter. And what else is true about actions is that they are more within our control than the social determinants of health. So they are like that little thing that we can hold on to and make a difference for ourselves, friends, the people we encounter in our work, in our lives outside of work. So for me as a dietitian, I'm going to be recommending to patients, regardless of their size or shape or anything else, that to the extent available to them, they follow a plant-based diet, meaning the things I've written here, and that they try to be as physically active as they can be in a way that's enjoyable for them. Because at the end of the day, you don't have to believe every single thing that HAES or intuitive eating has suggested for you. But we can all agree that it is useful to focus on behaviors, and that behaviors that are healthy habits, are helpful for everybody.